Thank you, Danielle. Well, this weekend is a big one for breast cancer with the Donna Marathon. Approximately 1 in 8 women are diagnosed with breast cancer, but compared to years ago, more people are living longer and thriving after a cancer diagnosis. That's thanks in part to new treatments, which include breast surgery. This morning, Dr. Jakub, a breast cancer surgeon at Mayo Clinic's Jacoby Center for Breast Health, joins us to talk to us about the latest innovations in breast surgery. Good morning, Dr. Jakub. Thank you so much for joining us.
Good morning, Corley. Thank you.
Well, let's start with a simple question. Is surgery traditionally a part of every breast cancer patient's care regimen? If so, why?
Yeah, surgery certainly has a major role in the treatment of breast cancer, and removing the tumor is felt to be necessary for the cure of most breast cancers. Now, I can tell you, we and the breast cancer research community is working very hard to put surgeons like me out of business, which I fully support. There will come a time in the future where a patient has a needle biopsy of her breast cancer, and based on that, we identify very specific targets, and we can deliver very individualized therapy to that patient, which will make her cancer go away with enough confidence that we don't have to operate. That is active research going on right now at many centers, and that I see as the future. We're not quite there yet, but I do see that coming.
Yeah, and you know, this approach has changed surgery over the years. Can you explain a little bit more on that, just how you've seen this change?
Yeah, the surgery for breast cancer has changed dramatically over the years. So historically, all patients had to undergo a mastectomy, and specifically what's called a radical mastectomy, which is very disfiguring. We almost never perform radical mastectomies anymore. Most patients today who present with breast cancer can have a lumpectomy, which means removing the breast cancer with a surrounding rim of normal breast tissue. Often that's followed by radiation. And sometimes we combine that lumpectomy with our plastic surgery colleagues and do things like a breast reduction or a breast lift at the same operation. And what I want to stress and highlight is a lumpectomy has the same cure as a mastectomy for patients who are eligible. So it's not that one treatment is better than the other. Some patients do require a mastectomy because their tumor is either too large, or some patients prefer to have a mastectomy. Now, mastectomies today, there are 3 major types. A patient can have what we call a simple or total mastectomy, in which they go flat-chested, or patients may elect to have reconstruction, which we combine under the same anesthesia with the plastic surgeons, where we save the skin to optimize the appearance. Or in some cases, we can even save everything you see on the outside, which is the skin, the nipple, and the areola, and that's called a nipple-sparing mastectomy.
All right, and you know, we often hear one of the biggest risks to patients who undergo breast surgery is the development of a condition called lymphedema. Can you just explain to us what lymphedema is?
Sure. Lymphedema is a fear patients understandably have when undergoing breast cancer treatment. And lymphedema is swelling of the arm because when we remove the lymph nodes under the arm to treat the breast cancer, that can make the flow of lymph from the arm sluggish. So lymphedema is swelling of the hand or arm on the side of breast cancer treatment.
All right.
Go ahead.
Oh, sorry. You know, you could go ahead and expand. You know, we definitely want to make sure our viewers know more about that.
Yeah, so there are a number of ways we're trying to reduce the risk of swelling of the arm or lymphedema after surgery. One is avoiding lymph node surgery altogether. And there are patients who have favorable tumors in which we don't have to check the lymph nodes, which is an ideal situation. The lymph node surgery has become less aggressive for most patients. One study that we're involved with is we inject blue dye in the arm, and that travels to the lymph nodes. And we can identify that blue dye when we're removing the lymph nodes for breast cancer and try to protect them. And that way, again, keep the flow of lymph going and minimize the risk of lymphedema. We're fortunate to be in a national trial where Mayo Clinic, Florida is the second largest enrolling site for that study nationally. A third thing, go ahead, I'm sorry.
Sorry, well, I hate to cut you off because this is all such wonderful information, but we are running out of time. But I just want to thank you so much for joining us this morning. Definitely important information. Thank you so much.
Thank you, Corley.